Chapter 13, Part 3, Depressive and Mood Disorders. Emotions Gone Awry. Mood disorders, also called affective disorders, are a category of mental disorders in which significant and persistent disruptions in mood or emotions cause impaired cognitive, behavioral, and physical functioning. Major depression, like some poisonous fog bank. Major depression is characterized by extreme and persistent feelings of despondency, worthlessness, and hopelessness, causing impaired emotional, cognitive, behavioral, and physical functioning. The actual symptoms are shown elsewhere in this presentation. In general, depression is often accompanied by the physical symptoms of anxiety. Suicide is always a potential risk. Abnormal sleep patterns are another hallmark of major depression. To be diagnosed with major depression, a person must display most of the symptoms described in the video presentation accompanying this chapter for 2 weeks or longer. Dysthymic disorder involves chronic, low-grade feelings of depression that produce subjective discomfort but do not seriously impair the ability to function. Some people with Dysthymic disorder experience double depression, characterized by one or more episodes of major depression on top of their ongoing dysthymia. Often called the common cold of psychological disorders, major depression is the most common of all the psychological disorders. It affects some 13 to 14 million Americans annually. Women's lifetime risk of major depression is 1 in 4. Men's lifetime risk is 1 in 8. This is because women experience a greater degree of chronic stress, have a lesser sense of personal control, and are more prone to dwell on their problems. Left untreated, depression may recur and become progressively more severe. In seasonal affective disorder, sometimes referred to as SAD or SAD, episodes of depression typically occur during the autumn and winter and subside during the spring and summer. Bipolar disorder involves periods of incapacitating depression, alternating with periods of extreme euphoria and excitement. It was formerly called Manic-Depression. A manic episode is a sudden, rapidly escalating emotional state characterized by extreme euphoria, excitement, physical energy, and rapid thoughts and speech. For most people with bipolar disorder, a manic episode immediately precedes or follows a bout with major depression. During a manic episode, people sleep very little and display boundless energy, wildly inflated self-esteem, grandiose ideas, which may represent delusional or false beliefs, and a flight of ideas. Some people experience Cyclothymic Disorder, which is characterized by moderate but frequent mood swings for 2 years or longer that are not severe enough to qualify as bipolar disorder. The prevalence and course of bipolar disorder. Typically, onset occurs in the person's early 20s, affecting about 2 million Americans annually. For both men and women, the lifetime risk is about 1%. In the vast majority of cases, bipolar disorder is a recurring mental disorder. A small percentage of people with the disorder display rapid cycling, experiencing 4 or more manic or depressive episodes per year. Explaining mood disorders. Multiple factors appear to be involved in the development of mood disorders. Family, twin, and adoption studies suggest that some people inherit a genetic predisposition to mood disorders. Disruption of the neurotransmitters norepinephrine and serotonin have been implicated in the development of major depression. Antidepressants lift the symptoms of depression by increasing the availability of these neurotransmitters. Abnormal levels of glutamate may be involved in bipolar disorder. Lithium effectively eliminates symptoms of both mania and depression. Major depression is often triggered by traumatic and stressful events. Chronic stress can also produce major depression. There is some evidence that stressful life events also play a role in the course of bipolar disorder. Does smoking cause depression and other psychological disorders? People with mental illnesses are nearly twice as likely to smoke cigarettes as people with no mental illness. One possible explanation is that people with a mental illness smoke as a form of self-medication. Nicotine affects multiple brain structures and neurotransmitters, the same ones that are directly involved in many different mental disorders. Another explanation suggests that smoking triggers the onset of symptoms in people who are probably already vulnerable to the development of a mental disorder, especially major depression.